My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Dr. Alex Wolfe is a Blair Upper Cervical chiropractor out of Meniere, Michigan. In chiropractic school, Dr. Wolfe used to get severe, debilitating migraines that could last for days at a time. Upper Cervical Chiropractic was able to resolve these severe migraines and give him his life back, and now he is helping others do the same. Dr. Wolfe has a thriving family practice an hour north of Detroit, Michigan, and today he shares with us his story. Please welcome Dr. Alex Wolfe. Today on the Expect Miracles podcast, we have Dr. Alex Wolfe. Dr. Alex is a Blair Upper Cervical chiropractor about an hour and 20 minutes north of Detroit, Michigan. Dr. Alex, how you doing today?
I'm doing well, Kevin. How are you?
Very well. Excited to have you on the show today and get a little story about you and all the great work you're doing up there in Michigan.
Yeah, I'm happy to be here. Thanks for having me on. It's a real pleasure.
Absolutely. Yeah. So, Alex, where are you from originally?
So I was born and raised about 7 miles from where I'm sitting at this very moment, a little town called Lapeer, Michigan. Grew up there, had my first chiropractic adjustment there, and then left there about as soon as I turned 18 and came back when I was fully grown.
Nice. What were you into growing up?
I was a three-sport athlete in high school and big into hunting and pretty much anything outside.
Nice. So was that a thing for you growing up, going to the chiropractor, or did that come a little later in life?
Well, my experience with chiropractic was a lot different back then than what I usually like to see now, because we very much were in if it hurts, you go to the chiropractor, and once it stops hurting, then you're done. So lots of sports injuries, things like that. It seemed like I found myself there for one or two visits, and then I just kind of trundled along until I hurt myself again.
Yeah. And so, Alex, what made you want to become a chiropractor?
Really interesting. My mom was not very healthy when I was growing up, and she had a number of different ailments going on. They kept kind of chasing it around, trying to figure out what it was. Eventually, they labeled it as lupus. Being middle school age, and your mom's kind of not really functional, kind of was an experience. And then she was having a lot of musculoskeletal pain, and so she went to the chiropractor for pain and got adjusted and started noticing that it was very helpful for things besides just her pain. Started feeling like she was clearer and she was getting herself up and about, more energy, all that. So once I saw that it was a little bit more than just hurts here, push here type of approach, it got me really excited.
Was that upper cervical or was that full spine?
No, that was a full spine guy that still practices about 4 miles from where I'm at now.
Yeah, so they do get good results. They chiropractic in general is it's a great profession, no matter what you're doing.
Yep, and my wife is a full spine chiropractor in the office here with me.
Nice. That's probably very beneficial.
It's great, yeah, because every once in a while I don't claim to be a wizard at everything, but I definitely know how to adjust an atlas. But she can step in on my patients and consult, and a lot of her patients, she's really good at isolating, who would benefit from that, higher level of care. So we work really well together.
Absolutely. Yeah. So Alex, what made you pick upper cervical chiropractic? Because not many people know about it, but you went to Palmer with the original school of chiropractic, correct?
Correct. Yes. I went to Palmer in Davenport, Iowa. And, in your fourth term there, you take a course called toggle recoil. And that's kind of like, as far as upper cervical goes, that's the roots that a lot of people kind of start in. And the technique that's been around for a long time, and it's helped, I would say, probably millions of people through specific upper cervical adjusting. But so in your fourth of 10 trimesters while you're out there, you get kind of start playing around with that a little bit. And there was a guy out there by the name of Dr. John Straszewski, and he was my instructor, and that guy was very influential in getting me started in my upper cervical journey. But in that class, so at the end of the class, you go through, you learn how to take the x-rays, you get trained on the adjustment, you drill on the adjustment constantly, and try to refine that and get it, more specific and more specific. And then at the end of the class, if you've done really well, then you can adjust your partner. As long as, you've gone through and you verified that misalignment is there, you can go through and fix that subluxation for your partner. And so that's a lot of times the first opportunity you actually have to adjust somebody in chiropractic college at Palmer. And so here I am, fourth tribe and like a year or so into the chiropractic training, and I haven't gotten to do an adjustment yet. I've just been learning all the meat and potatoes stuff of, anatomy and physiology and everything else. And so got my adjustment in that class by someone who was giving their very first upper cervical adjustment or adjustment ever, and instantly felt the difference. Like, I would definitely not call it the most specific or the best adjustment I've ever gotten.
Oh, so you were the patient there.
I was the patient. Yeah. And so,
okay, gotcha.
And I'd been adjusted in the student clinic, having upper trimester students working on me. I didn't really notice a benefit. I mean, I was having a lot of neck pain. I started getting really bad migraines when I was in Palmer.
Okay. Yeah.
I was getting what's called hemiplegic migraines, where like the whole left side of my face would go like numb, and I was having a lot of visual trouble. And
wow, that's pretty scary.
Yeah. And I had a cousin that had, a fairly severe stroke in his 20s, and I was still kind of dealing with the effects of that, and it impacted him quite severely. And so that's kind of always been in the back of my mind. And so when I started having those, I was really, really concerned. And so I kept getting checked out.
How long would those last for?
Usually about like a day and a half. So it seemed like,
wow,
yeah,
that's a long time.
Yeah. And it was always one of those, like, if I could go to sleep, that was the big thing. But it's hard to sleep when your mind's running a mile a minute and you're worried that something serious is going on. And if I could go to sleep, I could usually get through it, like just shut everything else off. A lot of times it would keep me awake, not letting me go to sleep.
Jeez.
So when I got adjusted, I felt something different, and I felt like I was thinking a lot clearer. I was having some pretty cool stuff going on. Almost like, that movie where the guy takes the pill that makes him smarter.
Oh, yeah.
Yeah.
With Bradley Cooper?
Yeah. I felt like somebody just gave me the adjustment that made me smarter, right? And so I got really curious. Like, I knew there was something more going on up top there. I got into a clinic, and Dr. Todd Hubbard was my doctor. He's another Blair doctor out at the Palmer College Clinic. And so he was overseeing my care. And then through Blair, that's really how I got into Blair, because I knew there was something going on up top. Like, I had to figure this out, why I was feeling so good after that initial correction. And so then I got to the point where I was getting to the point where I had like one of those every couple of weeks, those migraines.
As opposed to what, like almost every day?
No, that was my good. My good was one every couple of weeks. That was my bad. That was the worst that it got. But it's been 2.5 years since I had my last one now. I get adjusted or checked and adjusted when needed regularly. And if I'm out, I can feel it. And it's funny because my demeanor changes. My wife can, being a chiropractor, we have jokes in our house that are a little different than most people's probably. But if I'm being kind of if I'm being a little grumpy or a little gruff, she just says, do you need an adjustment? And so, but a lot of my patients describe the same thing. They just feel like they're in a funk when they're out of adjustment.
Absolutely. I'm the same way. I feel like the walls are kind of coming in on me when I'm out of alignment. Like, it's like, I'll honestly know it right when I wake up. It's really tough to get out of bed, like just for no reason. Like, the anxiety kicks up, the depression for no reason kicks up.
Right.
And then as I go throughout the day, I'm like, oh man, I'm probably out. And then sure enough, get it put back in and everything just starts to dissipate and the world just starts coming back to me.
Yeah. Well, I'm a chatty guy usually. And so one of my big indicators is somebody will give me all these opportunities to have a really fulfilling or really interesting conversation. And I'm just yes or no answers.
You're
and
just
like,
not having it.
Yeah. I'm just like, I don't want to communicate with you right now because, I'm feeling like crap.
Absolutely. So Alex, that's a pretty amazing story. I didn't know that. So what was it like after you graduated? It can be difficult to pick up the upper cervical work as a fresh new student graduating. What did you do right after graduation? And what was the process like for you?
When I was in school, so we had a Blair as an elective at Palmer, so we could actually take it in a very structured class setting. So that was a huge benefit. So once I took it, I then helped instruct it a couple of times, just kind of walking around. And,
nice.
I sat in on the class a few times after that and just helped the instructor. So that kind of really helped solidify it for me. I spent my second to last term in chiropractic college on a naval base. I was working in a naval hospital with a chiropractor on base there, California. And so while I was out there, we weren't allowed to do the specialized imaging that went along with upper cervical. So I wasn't really able to practice true upper cervical on the base, even though I think a lot of those pilots and the ground crew would have really benefited from it. I was out there in California, which is kind of like the mecca of Blair Upper Cervical. So I was out in Tom Forrest's office. I went down and saw.
Doesn't get much better than that.
No, yeah. I mean, he started talking about making guys review x-rays out in the shed in his parking lot, and I was getting nervous. But so I spent some time there. Dennis Campbell, went down to Drew Hall's, all these great doctors out there, and got to see some great stuff. So that really helped me kind of see how the office procedures worked and what it would actually look like in practice. And then I had a great opportunity to precept in Birmingham, Michigan, just down the road from me a little ways, with Dr. Dan Judge. And so I spent some time and eventually kind of covered his office a little bit for him when he went on a vacation, and got a lot more hands-on time there. And then we jumped right into, after I graduated, it was like 8 months later, I think, that we had our office up and running.
Beautiful. Wasting no time there.
Yeah, I figured, if I'm going to do it, I'm going to do it for myself. I got a lot of good advice. I had a bunch of great mentors in the upper cervical realm that I'd already mentioned. And like Dr. Remnick Bogle, he's at Life West right now. He's the technique chair out there. He was super helpful because he ran a practice and was an instructor and had a family and everything. So it was nice to be able to get advice on how to balance life and practice.
Oh, absolutely. I don't think you can do the upper cervical work in the very beginning if you don't have 2 or 3 doctors that are very experienced, like on call, because pretty much a lot of the patients we see, they've been everywhere else and they're looking for that miracle because they've heard upper cervical has done that for them. And one of my first patients, the entire left side of her body was numb. So I was just like, what do we do here?
Yeah,
so like,
I'm a month or two out of school. I can probably take care of that, right?
Yeah. Yeah. So you see a lot of serious issues. So it's very important to have such a great mentors along your side when you're doing the upper cervical work, like it sounds like you had, which was great.
Yeah, and I continue to have. And that's the one thing that I think when I was in school, I was a part of this great leadership program at Palmer. And, we always talk about steel sharpening steel, right? And so, you surround yourself with people that force you to be better, and you talk with them and you get an idea of what makes them successful and what you can integrate into your life. And when we had last month, we were at the Blair conference in Nashville, and it's like, you don't get much better of a room of people to talk to and learn from than when you're at that event. And so I was like a kid at, I don't want to go to Disney World. I want to go to another Blair conference.
Yeah. And it's amazing how many great doctors are in that room that are willing and happy to help.
Yeah.
I mean, a lot of people say, like, how do you get a mentor and how do you do this? It's like, well, did you ask the person? Like, it might even be just that simple. I don't know a lot of people that love what they do so much that aren't willing to help. Most people are definitely willing to help.
Yeah. And I just got another request, people wanting to come and intern at our office. And so that last little capstone program or whatever. And this is the first one where those even feasible, they have these requirements. You have to be so many years out of school and everything. And so I'm so excited to eventually be able to bring students into the office and be able to offer them that opportunity. And I don't know everything, I think I've learned a lot in a short time, but be able to pass that along, give them a good head up in the world.
Absolutely. Well, and I'm sure you've had one of your biggest learning curves was covering for Dr. Burcon's office at the Meniere's Institute in Michigan, because they get a ton of people Meniere's can be very debilitating, an inner ear disorder, vertigo, ear ringing, nausea, headaches, drop attacks. It's pretty severe stuff. So I'm sure you got a lot of experience with that up there.
Yeah, that was a huge culture shock for me because, it's about a 2-hour drive. So I would leave my office on Thursday nights after seeing patients till about 7:00, and I would drive a couple hours and set up shop and sleep in his basement and work all day Friday and Saturday. But, I see probably 15 to 20% of my my patients are Meniere's patients. And you go out to his office and it's probably 80, 85% are Meniere's patients. So you walk into the waiting room and it's a full waiting room. You can tell who's having a good day and who's having a bad day just by taking a scan around there. Cause like you mentioned, it's very debilitating. So that was a huge kind of, every patient almost is a Meniere's upper cervical case, but people talking about where they started and where they are at was just every day you got, your cup was refilled with all these people talking about, thank God I found this because I didn't know what I was going to do. And people talking about very permanent solutions to these problems, taking their own lives and things. And it weighs on you, but it also gives you a super high sense of duty, right? Like I have to be here. I have to be better at this so that I can help these people, because who knows what's going to happen if we can't help everyone that's got these things.
It's sad and amazing at the same time, because most of those people in that office, or anybody with like a debilitating issue like Meniere's or whatever it may be, sometimes the standard Western medical route tells these people, you know what, this might be your new norm. You might have to live with this for the rest of your life. And you know what, that might not be the case. We've seen upper cervical chiropractic literally give people their lives back that have been told that there is no hope.
Yeah. Well, one thing, I don't know if you knew this about Dr. Burcon or not, but he had a very close personal relationship with James Tomasi, the What Time Tuesday, the guy that wrote that book about trigeminal neuralgia.
Yeah, that's like one of the most phenomenal stories ever.
He's gone out and like they go out to eat and stuff when they're in town, and like very close friends. But not only has he got this huge Meniere's population, but that other, 15, 20% of his office is, he's got trigeminal neuralgia patients. He had a woman in there with glossopharyngeal neuralgia, which is like the same thing, like burning mouth syndrome, basically. There was just these really like there wasn't like a straightforward, like what I would consider like a routine case. I don't think ever working with him.
Was he the one that adjusted that What Time Tuesday guy?
I think he cared for him later on. He wasn't the initial guy or the initial chiropractor that took care of him. I'm not sure the whole backstory there, but every one of his patients gets a copy of that book. So it's a great story. And I've kind of been thinking about getting the books in my office too, because it's an easy read and people just understand after that, like the power of what we're working with.
Absolutely. I mean, just the spark notes of that gentleman had, he had trigeminal neuralgia.
Yeah, so he had trigeminal neuralgia. He had, the whole What Time Tuesday. I don't want to ruin the story for anyone that's going to read it. So spoiler alert here, I guess you might want to fast forward a little bit. So he had trigeminal neuralgia and had suffered and had kind of sought out a bunch of different options and had little to no relief with anything. And so he had kind of decided that it had come time to end his life. And so his wife and his son, I think, or his child, were going to be out of the house. And he was going to, he had the gun, he had the ammo, he had everything ready to go. He had the date and time picked out. Like, I think it was the day before his wife heard something or found out about something about upper cervical chiropractor and like asked him to go and at least try it. And so he said, well, what have I got to lose? I think it was the next day he was going to end his life. And he went through the whole thing, got adjusted. And like for the first time, and I don't know, I think I was in years, had like a period of, it wasn't, I don't think complete resolution, but it was this like glimmer of hope, right? Then he started going, like, he's like, well, I can always push it back a week, or, I can schedule another time.
Yeah.
But yeah, that's where the title of the book comes from, is What Time Tuesday, because he had picked a time on a Tuesday that he was going to end his life. And upper cervical chiropractic not only gave him a glimmer of hope, but eventually resolved the issue to the point where he considered himself to be pretty much cured of trigeminal neuralgia at that point.
That's just amazing.
Yeah.
So, Dr. Alex, what kind of patients do you see in your office that you've been getting a lot of, and some issues that you've been able to help with?
Yeah, so obviously with the groundwork that Dr. Burcon's laid out, we see a good chunk of our offices, the Meniere's patients. I've seen, my fair share of the trigeminal neuralgia, and like another really common one is the occipital neuralgia, which is basically a severe pain in a different nerve pathway. And we've had really, really good results with that. I feel like, as much as Meniere's, I feel like the success rate is incredibly high, higher than a lot of other medical procedures that are out there, or medications, like, probably in the 90 percentile of people that were with Meniere's were able to help. Trigeminal neuralgia seems like it's even higher. Like, it seems, at least in my office, I don't know if maybe I've got a little bit of a different feel or a little different take or what, but it seems like those are the ones that really respond well. And then my wife, she's a pediatric pregnancy chiropractor, so I see probably more upper cervical, like younger patients, because out of that than a lot of people. So we see a lot of feeding issues, a lot of chronic ear infections, those things.
They definitely clear up, right?
Oh yeah,
they definitely clear up, right?
Yeah, you're adjusting a little baby, and obviously we modify our techniques a little bit to make sure that it's safe and comfortable. But the adjustments are amazing, and they'll fill a diaper right there after they've been constipated for 2 or 3 weeks, and it's amazing to watch how quickly their bodies respond.
Yeah, I love adjusting kids. I mean, it is a healing process, but sometimes you get the result like right away, and the parents are thrilled, and then they get under care. It's amazing to see.
Yeah, but probably my favorite thing is like when people come in, and I get a lot of headaches and neck pain, right? That's kind of our bread and butter. That's what people hear upper cervical, and that's what they think of, is like, oh, you can help people with this pain in this very specific area of the body. my favorite thing is, people come in regardless of what they come in for. Kind of, we were talking about this earlier, is that most of the time their overall outlook on life increases as a subsequent effect of the adjustment, right? So people that are struggling with anxiety or post-traumatic stress or depression, they'll come in and like they weren't there for that. But after the adjustment, not only do they feel better physically, but they feel like their emotional state and everything is resolving and kind of coming back to a nice neutral center point where it belongs.
Absolutely. Yeah, that's huge. So, Dr. Alex, where are you located and where is your practice and where can people find you online?
We are located in Meniere, Michigan. So like you mentioned at the beginning, it's about an hour to hour, 20 minutes north of Detroit, depending on traffic. We're kind of just outside that metro Detroit area. It's in Lapeer County. So we are available on our website at Wolfe Family Chiro. So it's Wolfe with an E, family, CHIRO.com. We got a nice little website set up. We're on Facebook, Wolfe Family Chiropractic. We have Twitter. Like I said, I'm a chatty guy. It's hard for me to keep it under the character limit there. So it doesn't
I don't have a Twitter either, but yeah.
And then our phone number here is 810-212-1200. So we like phone calls. It gives me an opportunity to talk it up with people.
Absolutely. And Alex, if there's one piece of information that you would like to share with the audience that's really resonated with you over the years, could be absolutely anything, what would it be?
Don't give up. I mean, I feel like there's so many people that come into my office and they sit down and they feel like they've already kind of given up, right? They're just kind of grasping at straws. And there's always an answer out there. And I don't think that upper cervical is the answer for every single thing every day of the week, but I think it's highly underrated as far as where it should be positioned in the healthcare realm, what it can do. And it really, it's hard for patients when they get that first adjustment and it doesn't all happen at once. I tell my patients, once in a while the adjustment is like breaking a dam loose and all of a sudden it can be that quick. And then other people, it's like you're lighting a candle and, you got to let things burn. And it's frustrating when it takes time, but we're big on education in the office. And there's nothing worse than watching an upper cervical patient. Like you start seeing that little glimmer of hope and they've had it. And they're like, nope, I've come 2 or 3 times. I'm not seeing that miraculous thing that all my friends told me about and I'm done. And because you can help them, but they're impatient or they're just so ready to give up that it's become a challenge for them to hold faith in anything.
Absolutely. I mean, true healing takes place over time. One of my best Meniere's patients didn't really feel any different for about 2 months, and around the 3-month mark, everything started to shift and go away because she stuck with it. And most of the time we see some people that have been out of alignment for 20, 30, 40 years. So sometimes it doesn't happen overnight and you got to hang in there and let the body do its thing and heal. And it could take a little time.
Yeah. I wrote a whole paper in college about our loss of faith in the body, right? Like people constantly are forgetting that the body is what ultimately all healing comes from within, right? And so as much as you and I we're facilitators and healers in our own way, we're really just helping the body do what it's supposed to be doing. And I'm very humble about that. I tell people my ego is the last thing in the door when I'm taking care of somebody because I don't need it. I don't need it to help somebody. And all I need is a good, solid assessment of what's going on with your body and the confidence and the skill to correct it. Once we get that adjustment completed and get out of the way and allow the body to start really taking over and do what it's supposed to do, a lot of people lose faith in the body. They forget that the body's got all this wonderful healing potential and that nothing ever gets fixed in the body without that innate driving force controlling it. And so don't give up, because if you're kicking, breathing, and even if you're in pain, you still have that innate potential inside of you to get better. And it just takes the right adjustment at the right time or the right intervention at the right time to make that happen for you.
Absolutely. I love that. Well, Dr. Alex, thank you so much for coming on. I really appreciate it. I'll be in contact soon. All right.
Yeah. Thanks, Dr. Kevin. It was a pleasure. And hopefully I'll come back sometime or check us out when you're in Michigan. And I hope to visit. You got quite an awesome office out on the East Coast from what I understand. So I'm going to have to come check that out.
I would love to have you. Yeah.
And if not, we'll see each other at future Blair conferences. And it's always a good time getting together with those guys.
Absolutely.
Have you noticed how many women Blair chiropractors there are now? Like, not that that's surprising, but it's been awesome to see like how many. I think in chiropractic college they said it was like 1 to 10 chiropractors, men to women. or something, or 1 to 3. And it's like,
Yeah.
I feel like,
Yeah, there's a lot of women, and it's just growing in general. Like the last Blair conference was truly amazing of how many people are actually settling down and doing this work and are all about it. It's grown since the last 4 or 5 years I've been a part of it.
yeah, it's been amazing.
I'm sure you've seen the same thing.
But so that gives me hope.
We need
for
more
the
people
future.
doing it.
Yeah, exactly.
Yeah. It's nice to have people flying all over to your office, but we got to definitely do a better job of getting more Blair doctors in those areas.
Yeah, and I think that whole, the Blair Society's goal, right, is a Blair chiropractor in every community in the world, and I think we're getting there. We got a long ways to go.
We're on our way.
Yeah,
we got a long way to go, but we're getting there.
Yeah, because it's nice because you can refer in confidence too. So
yes, that's what I love about the Blair technique. You can get a Blair adjustment in New Jersey, and then I can send you to Dr. Alex, and he can do his neurological testing and deliver the exact same adjustment if needed.
Yep.
And that's really what the profession needs, is just some reliability, because if someone says they're going to a chiropractor in America, I have no idea what they're getting. It literally means nothing.
Right. Yeah, it's hard to know if they're going to even get an adjustment out of that whole process. And I don't know what it's like out in your community. And I'm fortunate to have a lot of good full spine chiropractors in my area. There's not any real shady things going on. But I have people that come and they've moved to the area or something, and they're not sure what chiropractic's all about, even though they saw a chiropractor for years or decades. They took a lot of vitamins or something, but they ultimately never got what they needed.
Yeah. So if anybody's looking for a Blair chiropractor, you can go on blairchiropractic.com, click on locate a doctor, and pretty much everybody on the website knows the protocol and is a good doc, and they can give you the proper Blair care.
Yeah, absolutely.
All right, Doc. I will talk to you soon. Okay.
All right. Sounds good, Doc. Thanks.
Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.